Real hard on this. We spent 60 hours in committee meetings with both Republicans and Democrats dealing with hundreds of amendments. Months of work went into it by members of the staff long before that. We worked real hard on this. I'm going to talk a lot about this bill, okay? I know there's a House bill. That's wonderful. But that's for someone else to talk about. I'll comment on policy. I'll do my best to try to analyze what the Finance Committee in the Senate might do in September. They haven't done their work yet. This is a bill that was voted out of committee. I voted for it. It was voted 13-10. So most of my attention will be here. I don't want to foreclose the possibility that you might have a question that may not be addressed or that might go beyond this bill. It's America. You can ask whatever you want. But the focus of my attention will be on this bill. Maybe I'm a little parochial here, but this bill hasn't gotten a lot of attention yet.
What's the number?
We're going to give it as much attention as we can today.
What number is it?
What number?
The bill is the Affordable Health Choices Act. It technically doesn't have a number yet. Okay, the Senate bill will have a number, and the whole Senate votes on this. 23 members of the Senate have voted on this bill. So, and you can go to our website and get to the committee's website. It's about you cram it all together with amendments and change. It's about 685 pages. My count is 685. The pages don't matter. I'll try to refer to section numbers, and that's the key thing that won't change. So that's point number one. Point number two is we have an important debate, and I want to highlight a couple of things before we go to questions. Let me go to the first slide. Just the where we are now, where we're heading. Okay, this isn't the whole story, but by one estimate, I know there were a lot of estimates, but that estimate of 44,230 losing their health care every week is a bad indicator for the country. It's an embarrassment that a country as strong as ours is allowing that to happen. Okay, that's where we're headed. That's a projection for Pennsylvania. 178,000 people projected to lose their coverage in that roughly three-year period. The last one might be the worst of all in terms of where we're heading statewide. Family coverage will cost that in 2016, 7 years, 51.7% of family median income. That is where we are headed by one estimate. I realize there'll be competing estimates, but that's where we're headed. I haven't met a rich family in Pennsylvania, a middle income or poor family that can pay more than half their income to health care. But that's where I believe we're headed. The national number, fortunately, for the rest of the people outside of Pennsylvania, the national number is about 45%. I don't think many Americans, if anyone, can afford that. So that's the path we're on. That's one of the reasons why I believe we have to make change. Let me go to the next one. Just some uninsured numbers as it pertains to Allegheny County and in the state. The state, of course, is on the right side. You see the adult percent uninsured. The Pennsylvania number, here in Allegheny County, about 5%, which is a lot less than the state. Thank God, in terms of what happens to. I'm sorry. Let me do that again. The adult numbers on top: Pennsylvania 877, Allegheny County 10%, almost 70,000 people. Thank goodness Allegheny County's adult number is 2 percentage points lower. But 70,000 people without health insurance coverage in Allegheny County. And remember, this is age 19 to 64. The top line doesn't include kids. It doesn't include people over the age of 65 or above. Age 19 to age 64, 70,000 without health insurance. If you think we can have a strong economy in Allegheny County going forward with 70,000 adults under the age of 65 without health insurance, I think you're wrong. The second line, the second section is on kids. Allegheny County, 2% uninsured, according to this survey done by the state in 2008. Thank goodness it's 2. That number is down a lot from years ago. You know why it's down? Probably a couple of reasons. One reason, definitively, I believe, is the Children's Health Insurance Program that, with all due respect to my buddies in Washington, Democrat and Republican, didn't start there. It started right here in Pennsylvania by a guy named Robert P. Casey and a good set of legislators. I want to give him credit because he deserves it, but I also want to